it's all well and good to say the NHS is crap. Thank you for training me as a dentist. I'm off privately now. So we're talking about public sector worker pay rises. We're talking about immigration. And who better to put head-to-head with Alex Phillips than the legend that is Mike Buckley, former Labour Party advisor. He will be an MP. Michael, good morning, sir. How are you? Can't hear him. Come on, you lot. Let's push the button. It's not a good start, is it? Oh.
I'm here.
Oh, you're there. There he is. You see, that's the Labour Party for you. Never pay their bills. How are you, my friend?
Very well. How are you?
I'm all right. I just wanted to start with the public sector pay round agreement yesterday. Sunak thrashed out this deal yesterday morning with Jeremy Hunt. Just to read this for people, they say between 6 and 8%. The police get 7%, Mikey. The NHS 6, junior doctors 6 with a £1,250 one-off payment. Prison officers 7, but the armed forces 5. Don't understand that correlation. And teachers 6.5. Before you tell me that everybody in the union skid, the fact is teachers, and I salute them this morning, have looked at the 6.5% and said, we are accepting that, we are ending strike. Surely, in terms of how it looks, for doctors, junior doctors to still be on strike, any sympathy is going to ebb away, isn't it, Mike?
No, well, it shouldn't do. I mean, the value of doctors' pay has gone down 35% in the last 15 years because of a combination of stagnating wages and inflation. So what they were earning in 2008, 2009 is nothing compared to what they're earning now. And as is famously said, many of them, particularly when they come into the profession, they're earning less than they could earn in Pret-a-Manger or a similar company.
But in Pret-a-Manger, Mike, you don't have the facility and the ability to end up with a big salary and a gold-plated pension. That's a fact.
Yeah, that is a fact, but you also don't have to work shifts for days on end, and you're not dealing with people, you're not dealing with life or death situation. So, I mean, I'm not putting down people who work in coffee shops in the slightest, but it's a different kind of gig. So I fully understand where the doctors come from. And the other point that the doctors' unions have made is we have a problem in our NHS, the doctors giving up working here, going to work somewhere in Europe, going to work in the States, going to work in Australia, going to work in New Zealand, because they can work fewer hours and shed loads more money. If the government wants to stop that happening, they're going to have to pay them more money.
Where from?
From either taxing people who can afford it, or from borrowing, or from using money more wisely.
We can't borrow any more, though, Mikey, can we?
We could, if it was going to be used for a good purpose.
Alex?
Well, it strikes me funny, isn't it, when we've got this inability to retain our medical staff, and all the countries they're going to largely have privatised medical systems, where actually if you put stuff in the private sector, you've got to offer people competitive wages. And I think that this is the problem. It's the biggest state-led department in the UK. It's probably the biggest national health service in the world. And whenever something's run by a government, it is completely racked with inefficiencies. And like I said, I agree that we must protect medical care being free at the point of access. But I don't see how this argument is constantly conflated with, and therefore the government have to run it. Don't let the government run it. Find a better system, find a better model. Everything's more expensive now, right? Medicines are more expensive. MRI scanners, all the modern technologies, keyhole surgeries. This has all got to be paid for somehow. And you cannot keep taxing and pouring money into a system that is no longer working, no longer fit for purpose and struggling. And yet we've never been able to have a proper conversation about this, because the minute anybody says, oh, maybe actually the way the NHS is structured isn't really good.
Well, let's have a proper conversation.
Yeah, exactly. I mean, I don't have the answer. I'm not an economist, right? And I don't know how to run a chain of hospitals. But when I was living in Belgium, and where you've got a sort of hybrid system where state care is funded by the government and then most people have health insurance with work, the network of hospitals that I used were absolutely excellent.
Well, let me put this to you, right? This is Cliff in Berkshire, Mikey. He says, JK, I would say that we could put more of a loyalty clause in a newly qualified doctor if we paid their training fees. Bear in mind, they do just leave training with over £60,000 worth of debt. Yes, you talk about big salary, but that is quite a commitment to make. What I would like to talk about, and you say a serious conversation, Mike, free medical help at the point of entry, a bit like the benefit system, in my humble opinion, was one of the greatest inventions of the modern world. And I understand that the Labour view would be we should tax the more wealthy who can afford it. Let's just take that for one moment. We can argue that the wealthy already pay a bit more tax. We can argue that they should pay more. I don't want to. What I want to ask is this: is it not fair to say that one of the biggest problems with the NHS, if we get away from management inefficiency, is that too many people are taking advantage of the NHS. When we sit and we say, oh, it needs better facilities, it needs better logistical planning, aren't people who have never paid into the NHS, not just migration, but aren't people using it for the wrong reasons? I mean, I said the other day on the programme, I think you were with me, 650,000 appointments were missed last year. What happens if you made somebody pay a £5 fine? What about the people who turn up at casualty because they've grazed their knee? Are the British public, do they need to take some responsibility? I don't know. I think it's a discussion that needs to be had, to be honest.
I think the British people are very responsible. I don't think people are using the NHS for the wrong reasons. The crisis for it has nothing to do with the ownership model and the fact that it's nationalised rather than privatised. I mean, if you compare our system, say, to the US system, which is fully privatised, ours is way more efficient and way better. There has been a problem with underfunding. When Labour was in power, they increased the amount of money that going against the NHS by 6 or 7% each year over 13 years. That's why it was so good when they left office in 2008, 2009, 2010. That's why it was record satisfaction levels. That's why waiting lists were a record low. We now have waiting lists of 7.5 million. We've got a problem with staff leaving to go to other countries or just giving up to go and work in other professions because they're overworked and they're underpaid. That's a problem. The government, when they came in 2010, they stopped raising the amount of money going into the NHS. They brought it down to zero. For quite a long time. Under Cameron and under May, it was basically at zero. Under Johnson, it started rising a little bit, but only going up to about 2%, nowhere near what Labour was doing. If you're not putting in a similar proportion of GDP as they're putting in, say, Belgium or Germany, you're going to get a worse result.
So why are we not putting that in?
Because the government's choosing not to.
Are we back to that? Are we back to that argument, Mikey, that they don't want to sort the NHS out? Surely they want to.
I mean, I don't know whether they want to sort it out, whether they don't. But the reality is that the reality is that they're not. So whether they want to, whether they're not doing it. I mean, it doesn't matter in a way where you get that money from. You can do it through general taxation, which I think is the fairest way to do it.
You mean the wealthy? You mean the wealthy?
No, I mean the general population, so we all pay into it. I mean, you say the wealthy pay more tax. I mean, obviously, in raw numbers, they do because they're wealthier. In terms of proportion of income, we all know the poorest pay most tax because they pay a huge amount, say, through VAT, because they're spending a high proportion of their money on essentials. VAT is applied, etc., etc. They pay a much higher proportion of their income in tax than the wealthy do, who are able to use accountants and who are able to use investments and so on and avoid a lot of it. There is an argument to say in straitened times that wealthy should pay more. I compare it to the housing crisis, or sorry, the inflation crisis that we have. The Bank of England's put interest rates up. Who pays that? People with mortgages, which is about 7 million people in this country. But that's invariably not the wealthy people because they've either paid off their mortgages or they buy their properties with cash.
Alex, what do you say to
that?
Middle-income people.
I agree with a lot of what Mike is actually saying. You know, people think, oh, she's voted Brexit, she must be some hardline capitalist, and I sincerely am not. And I've got a big problem with the wealth gap in this country. We've spoken about it a lot on this show. And I'm actually glad he brought up Belgium, talking about investment into healthcare, because I think that is a healthcare system that works superbly. I lived there for 3 years, and I think we should send a team of investigators over from NHS, go and see how it's run in Belgium, learn some lessons, bring it back here, because whatever they're doing over in Brussels, it works. And this is a city with a huge migrant population. This is the city that hosts NATO, that hosts all the European institutions. This is a city with a high population density, and yet I could literally go and phone my doctor's surgery in the morning, get straight through to a receptionist and have an appointment in the afternoon. I could even phone my GP after hours on her mobile phone if I had any concerns. It was utterly fantastic, and that is a part privatised system. I don't know why. This is what I'm saying. We need to go and find out.
Privatisation.
Send people over there and find out what it is they're doing so well.
I mean,
go on.
You have to decide where you're going to get the money from. You have to put in a certain proportion of GDP. We put in less proportion of GDP than Belgium, Germany, etc. You can do that through general taxation. You can do it through a combination of general taxation and then asking people to pay a surcharge. You know, like you pay a surcharge on your council tax, for your fire service, your police force, etc. You could do the same thing with the NHS. You can get the money in a number of different ways.
Roger says Mike Buckley, I didn't know you called Bailey. Mike Buckley failed to mention that the UK's population has increased by 10 million, which has put a stretch on every public service, and that's mainly due to immigration. MB, response?
We've also brought in, as we were saying the other week, I think, a lot of doctors and nurses from abroad. So, you know, and in fact, the government's running around the world now trying to get more doctors and nurses to come work in the NHS because they haven't trained enough people.
Have we allowed too many people into this country who are stretching our public services so that British taxpayers, and I'm talking about the wealthy, are struggling to get the care and the service value that they've paid for because other people are taking advantage?
Well, no, we're not, because we have a population size. We need people of working age in the population. Again, as we said, we have an ageing population, as in we haven't had enough babies for decades to actually provide enough working age people. We need to meet that need from somewhere. The only way to do it is immigration. The only conversation you need to have is where we want those people to come from, not whether we need them or not.
Interesting. Alex?
Yeah, well, the other problem here is about, you know, people not having babies. People can't afford to have babies. That's the whole point. People are not having babies because these days you need two parents in full-time jobs to pay for, you know, a mortgage and your kid. And what's happening with a lot of the inward migration is they come from societies where natalism is a huge thing. And the birth rate in a lot of people coming in from other countries is far higher than our own. We do not live in a baby-friendly country. And actually, it's a bit like, you know, Mike's right, saying, why have we been capping the number of medical students in this country and then having to import people from overseas, because you're then putting a drain on really valuable skills in those countries. A Romanian doctor here means one less Romanian doctor in Romania. So we need to be looking at using our own population, training people properly, and also coming up with a few natalist ideas. I don't understand why when you build new office blocks, they've got a breakout zone so Stan accounts can shoot some hoops and sit on a beanbag, a gym downstairs, a bar on the roof, and nowhere to put a kid, as if giving birth and extending the population was invented yesterday. I mean, come on, get real.
Mike, Steph, to finish. Mike Buckley is wrong. He's getting it this morning. Too many people use the NHS incorrectly. The number of failures to attend is massive across all services. No consequences for not attending, costing a fortune. Poor life skills leading to poor parenting and requirement on total dental clearances on kids as young as 2, as an example. The NHS picks up where every other sector leaves. DWP assessments, DVLA assessments, all required to be done by NHS. It's a bottomless pit and needs a complete overhaul, not just money. Your response, Mike Buckley?
Well, I mean, I'll say one thing. I read an article the other day by a right-wing journalist, in fact, Dan Hodges, and he was talking about his mum, Glenda Jackson, and her death and his experience with the NHS and other services of her dying. And his response was, this system doesn't need fewer managers. It needs more managers. I mean, he was just talking about, for example, the fact they needed to get a special bed, took them ages to get the special bed, and then when she died, they didn't come and take it away, and then somebody came around to repair it. You know, it's a system where it is a massive system. It probably does need some reform. It probably does need some better management. But again, that comes down to staffing, it comes down to training, it comes down to resources.
I have to get a break. Final word.
I actually worked in the NHS during all my holidays from university in admin. I processed invoices. I actually did fraud investigations.
That's so many bloody
I actually
jobs.
did fraud investigations into doctors and dentists, swindling the system. And one thing that I noticed is you would not get this level of profligate waste and mismanagement in the private sector.
Alex, thank you. Stay there. Mikey, great to speak to you, my friend. Take care. We'll see you very soon. This is Talk Breakfast.